Good morning, Gloria. My name is Graham Rappel. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Gloria Cruson.
And what is your candidate number, please?
My candidate number is 251079108.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you think is the best way to establish rapport with your fellow nurses?
I think the best way to establish rapport with my fellow nurses in the department and other members of the healthcare team is to promote positivity and communication in the workplace. I walk into the hospital excited about my day and the ability I have to change people's lives. I verbally recognize my teammates for excellent patient care, so they know that I notice and value their work. It's important to work in a respectful and collaborative environment, so seeking assistance and providing it in return has helped me grow my relationships with my co-workers.
Tell me how you respond to people who are in pain or otherwise suffering.
Firstly, I let them know that my priority is to make them as comfortable as possible. While communicating with them, I always use a soothing tone and compassionate facial expression. On a practical note, I'll check a patient's chart to see if he or she can be given an increased dosage of a drug to minimize the discomfort. If pharmaceutical interventions are not feasible at that point in time, I'll do my best to distract the patient by carrying on a conversation with him or her, offering some reading material or turning on the TV. Before leaving the patient's bedside, I always assure him or her that I'm available as needed.
Please describe the philosophy that guides you as you practice nursing.
If I had to sum it up in a phrase, it would be, always take time to listen, and never assume. About a year ago, I was caring for a patient who was deemed stable by his doctors. However, he kept complaining of feeling nauseous and experiencing jaw pain. Shortly thereafter, he went into cardiac arrest. I was part of the response team that ultimately saved his life, and that experience solidified my belief that I should always take time to listen to the patient's complaints rather than making assumptions based on doctors' reports.
What's your greatest weakness?
Even after years of experience as an ICU nurse, I still get a little stumped when I see deeply wounded accident cases. When I first began working as an ICU nurse, my mind used to go numb when I would see a patient with horrible injuries. There were times when I couldn't even be proactive and handle the matter smartly. When I realized this weakness, I started meditating regularly to train my mind to remain calm in emergency situations. Over the years, the meditation truly helped me and I was better able to handle gory wounds and accident cases.
What about your job as an ICU nurse satisfies you the most?
As an ICU nurse, one thing that really satisfies me is when I see a patient's health improve over the critical care days. As such, I have a very extroverted nature, and I make it a point to make ICU patients who are suffering from pain and trauma smile or laugh. A lot of patients have thanked me for my warm and friendly demeanor and have said that it helped them recover much quicker. When given a feedback form at the time of discharge, most of my patients give me a 5-star rating for my excellent nursing services. Receiving this excellent rating for my skills and services gives me the ultimate professional satisfaction.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The roleplay will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please?
Hi, good morning. My name is Gloria Cruson. I am one of the registered nurses working in this emergency department. You seem to be really nervous. Is it okay to share the reason with me?
My mom is so critical, and she is unconscious. The doctor has not yet seen her.
Being a son, your anxiety is quite appreciable. By the way, before proceeding further, may I know your name, please?
My name is Graham Rappel.
Okay, Mr. Rappel, I really acknowledge your worries. However, you should understand that your mother is successfully being treated with life support.
Can you brief what has happened to her?
All right, I can explain it to you. Well, don't be upset. She is in our safe hands. Now listen, your mother is dealing with a condition called a cerebrovascular accident, where the blood flow to a part of the brain is stopped, either by a blockage, or the rupture of a blood vessel.
Oh my God.
I am really sorry to inform you that your mother is in a state of coma right now.
Coma? What do you mean?
A coma is a deep state of prolonged unconsciousness, in which a person cannot be awakened, fails to respond normally to painful stimuli, light, or sound, lacks a normal wake-sleep cycle, and does not initiate voluntary actions.
But how?
Your questions are really reasonable. It's generally understood that coma is more common after a massive stroke, or a stroke that affects the brain stem.
So, what about the treatment for my mother's condition?
Please calm down, Graham. First of all, it's necessary to identify the reason for this state, and then, the doctor will initiate the treatment. Right now, please cooperate with us and give all the relevant information about the patient. The major treatment plan for a coma is supportive care and management. At this moment of time, your mother is there with full life support, and we are assessing her for any changes in her vital signs, such as blood pressure, pulse, temperature, oxygen saturation, etc. Am I clear to you?
Yes, but what is the possible outcome of it?
I regret to tell you that the chances of recovery depend on the cause of the coma, whether the problem can be corrected, and the duration of the coma. If the problem can be resolved, your mother can often return to their original level of functioning. Sometimes, though, if the brain damage is severe, it may be permanently disabled, or never regain consciousness.
Oh, no.
However, by monitoring the patient's conditions such as BP, vital signs, etc., her condition has not deteriorated since admission, but she is comatose.
Is there any medical treatment possible at this stage?
As I said earlier, she has been given all the support needed to survive.
No treatment has been given to her, other than life support. And how she is going to get better?
Graham, your concern is quite reasonable, and I can understand from your point of view. The doctor will diagnose the reason for the coma. And only after that, the possibility of the treatment can be said.
So, what is the possibility of recovery?
Some people who have a stroke recover quickly, and can regain normal function of their body after a few days. For other people, recovery may take 6 months or longer. No matter how long it takes to recover from a stroke, recovery is a process. Remaining optimistic can help you cope. Celebrate any and all progress she makes. Talking to a therapist would help you work through the recovery, too.
What kind of rehabilitation should I arrange for my mother?
Although patients in a coma are unconscious, it's possible that someone in a coma can still hear. Therefore, some of the best advice for helping your mother in coma is to talk to her. While it's not guaranteed that they can hear you, it's worth the effort and the chance that they can. Plus, it can also be therapeutic for you as a loved one.
Okay, anything else?
Another option includes Coma arousal therapy. This is an intensive treatment that involves vigorous multisensory stimulation, applied to the patient for up to 8 hours per day, every day of the week. But I'll have mixed probability of success.
Oh. Is there anything that can be done to help my mom from this situation?
Don't be in a hurry. The doctor will give you advice regarding these therapy sessions, and also he may prescribe some medication according to your mother's condition. Am I clear to you?
Okay, but how long should my mother stay in the hospital?
I am sorry to say that it is not my scope of practice to determine the stay. For that, you should talk with the doctor itself. Don't panic, the doctor will reach you shortly.
Shortly? In 10 minutes.
Sure, hopefully before that. Anyways, I will let the doctor know regarding all your concerns, so he will give answers to your queries clearly. Is that okay for you?
Yes, that's fine.
Thank you for listening to my words. Kindly wait here, and if you have any further queries, kindly press the buzzer on the right-hand side.
All right, thank you.
You are welcome.
That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.